Well, hello from True Potential Health. I'm Jackie Fleury, and I am here with Darshell Diaz, who is our osteopathic manual practitioner. As many of you may know, we've been waiting a long time for Darshell to join us here at the clinic, and we finally have Darshell here and doing a really amazing job of supporting our community of clients who may be suffering with chronic pain or digestive conditions. There's a whole list of maladies and pain conditions and I guess disturbances, health disturbances that Darshell is familiar working with. But today we're going to talk about the foot.
Yes.
Because I asked Darshell, make a list of some of the most common challenges that you might work with, and that helps give you a sense of how you might be helped by osteopathy. And so Darshell has chosen the foot. So that surprised me. And so I am curious to know, what is it about the foot that you are that you see so much of?
Well, with the foot, because it's responsible for weight bearing. And so sometimes people who have like flat arches, so because like our arches, they're meant to absorb shock and like transfer energy, like folks with flat arches have a little more difficulty doing that. And then because the foot, like when we do like our heel strike, like on the ground, it gets the ground reactive forces and it transfers it up like to our knees into our hips. So like our body needs to be able to adapt and compensate to that force that's coming from our foot. And if our body's not able to do that, then we can feel pain.
Oh, very interesting. So it's like, so are you referring to like being flat-footed, not having a good arch support?
And also even like just walking mechanics too, because like when we're walking, we want to have that dissociation between like our thoracic cage and our pelvis, and we want to have that arm swing. So we want to make sure that everything, so when we're looking at someone like walking, we want to make sure that everything's working in cohesion, everything's communicating, and it really starts with feet.
So if a person is flat-footed, what might they be likely to be experiencing? Would they necessarily feel it in the foot, or are they going to notice it in their hip? Or you talked about like you said thoracic, but you mean like in through your waist or through your chest. What might that person be feeling or noticing?
Yeah, so they might experience some like foot pain. They don't have to, but they can also experience maybe like knee pain or like knee weakness, hip discomfort. Sometimes their breathing mechanics may be off as well, because again, just not having that dissociation between pelvis and like thorax, it can affect our diaphragm and the way like we inhale and exhale.
That's so interesting. So, does having a bunion have anything to do with being flat-footed, or having pain in a bunion? Would that also affect all of that infrastructure that you refer to?
Yeah, it definitely could, because like the weight, so ideally we'd like the weight being evenly distributed at like the base of our big toe, at our pinky, and at our heel, so that the weight is being evenly dispersed. But sometimes that doesn't happen, and so we have areas in our feet that are absorbing like more pain, not more pain, they're absorbing more force than they should be,
Yeah.
which can cause pain and the discomfort.
So, do you deal with bunions?
We do.
Because I don't know, bunions, they can be a really big issue. So, okay, so flat-footed. So if somebody comes to you and you identify that they're flat-footed, what do you do? What would be something that you might be offering them, or what sort of like technique do you do? You don't have to tell us about the technique, but what is it that you're hoping to achieve? Like, what can you do for somebody with who's flat-footed?
So generally, like in our assessment, like I would look at their shoes, because I want to see like what the wear patterns are, and then I would look at them walking just to see like their walking biomechanics. Again, I can't, if someone comes in with flat feet, like I can't guarantee anything.
Yeah.
But like I would definitely try to make sure that the bones in their foot, they are moving the way that they are supposed to. I'm going to be checking like ankle mobility and stability. I'm going to be looking at the bones of like the lower leg and then the knee and the hip. And again, just making sure that everything's communicating communicating optimally with one another, and that the passageways, so that like the nerves and the arteries and the veins, like the passageways for them to pass through are nice and free, so that everything is getting nourished properly.
Mm-hmm. Makes sense. Circulation, right? Mm-hmm. So just sort of freeing up, because we know that if something is not circulating, it's congested, which can contribute to inflammation and stasis. Like things just don't move like they're supposed to, right? So great information. Is there, like, can you give us an example of one, like maybe like not necessarily a case study, but where you've seen like a before and after? Some you've come in, they've had flat feet, you've done all of that assessment, and what would be one result that they may have experienced, like an improvement or something that you can share with us?
Well, this wasn't with a person with flat feet. It was with an individual who had a little bit of like ankle instability. Okay, so talk about that.
Yeah, sure. Even though we're talking about feet, we can talk about ankles. Yes.
Yeah. So their ankle bone, so like their talus was just sitting a bit like more, I guess, forward, and so that was like impacting the way the rest of the bones in their foot was moving. So when they would walk, they didn't have that nice equal distribution of force. Like you could see it in their biomechanics. So I freed up their ankle, and like the next time I saw them, there was an improvement. They also felt better, like self-awareness, if that makes sense. So because like with our ankle and our heel, we have something called like the sinus tarsi, and that's where like the proprioceptors are housed. And like our proprioceptors, they send signals.
It's kind of like the whiskers on a cat, right?
Exactly.
Yeah, so
right?
It sort of tells you which way's up and which way's sideways, and
exactly. And so that individual, like when I first saw them, they felt that they had no like body awareness. But after treating like, the ankle and the bones of their feet, they came back and they're like, I can feel like, more evenly distributed. I can tell like, when I'm walking, like, on a hard surface versus a soft surface, because before they couldn't really like, really identify that. So it was pretty interesting.
Yeah. So, I mean, the exciting thing about the work that Darshell does is that it is at a whole sort of three-dimensional perspective. It's a way to understand not just the biomechanics, but the way your structure affects the way all other things flow and move in your body. So this is the first in a series of information videos that we'll be producing so that you can get to know Darshell before you maybe come in and meet her in the clinic, but also gives you an opportunity to understand a little bit about your practice, like the practice of osteopathy and osteopathic manual therapy. So thanks, Darshell.
Thank you.
If you would like to see Darshell in the clinic, Darshell is here at True Potential 1 week a month. So do not delay, because if you decide you want to see her, there is a strong likelihood that you may have to wait, and we don't want you to have to wait. So act fast. Take care.